This is the largest crowd we've had for these presentations, so I appreciate everyone coming. So what you have in front of you is the handout, which should correspond to all the slides that I'll have up here on the big screen. We'll go through this. There's a lot of information in here. A lot of it's basic. Some stuff will be new to you. Some stuff you'll learn a little bit more today. And then really I just want to explain a little bit about what is osteoarthritis, how do we get it, how do we treat it, how do we live with it. That's really the key that we want to look at today. There you go. Hi.
Oh, thank you.
You're welcome. So my name is Dan Garr. I'm the co-owner of HealthQuest Physical Therapy and Medical Fitness here in Oxford. We're south of here on M24, right by the BP gas station, just north of Drainer. Gosh, we've been here 17 years already in Oxford, and we were in the Village for 10 years, and now we're in our new building, which has been 7 years already. And as you guys know, as the older we get, the time just goes so fast. It's funny, I get a lot of my friends, they talk to me and say, Oxford, how's it working? How do you like Oxford? And I said, it's kind of like Mayberry. Isn't it? I mean, everybody knows something about everybody else's business, and the people are real, and if you just do right by people, you're golden, and everyone makes mistakes, and if you make a mistake, own up to it, move on, and usually everything is pretty darn good. So I finally have my wife thinking about if we are to move. We've been in Rochester Hills for 25 years. She's now looking, she goes, yeah, Oxford might work. She's a Rochester girl. I'm like, okay, now we're talking, because I could definitely see myself living here, which would be great. So, okay, so overcoming osteoarthritis. And let me see if I can figure out how to do this, how to get from slide to side. Okay, thank you, Parks and Rec. That's me. Married, I got 2 kids, both in college. Okay. So osteoarthritis. Does anyone know the definition of osteoarthritis?
Pain.
Pain. That's great. That's it. So if we break down the word, osteo means joint. Itis means inflammation of. Or arthro means joint. Osteo is bone, joint. Itis is inflammation of. So if you have tendinitis, you have an inflamed tendon. If you have arthritis, you have an inflamed joint or inflammation in the joint. Now there's 2 types of arthritis. There's 2 types of inflammation in a joint. I could be walking out of here today and slam my elbow into the door accidentally, and I go look an hour later and my elbow's all swollen up. Well, by definition, I have arthritis in my joint of my elbow because I have a swollen elbow joint. Well, that's acute arthritis, meaning the joint is inflamed because I was stupid and I hit my elbow on the door and it swelled up. Or if you turn your ankle and you sprain your ankle sprains, you have arthritis of your ankle at that moment in time. What most people over the age of 50, 55 deal with is degenerative arthritis. Degenerative arthritis is just, you've been on your feet, you've been living your life for 50, 60, 70 or more years, and the joint starts to break down a little bit. And that's really what our emphasis of the talk will be today, is that degenerative, how arthritis occurs. So we looked at the definition. Description, well, there's a couple pictures we'll show in here on the handouts of what like an arthritic knee looks like and what a normal knee looks like, and it's pretty gnarly as things get older, and a lot of it is really based on genetics too. So if you look back and say, yeah, my dad and my grandfather and my great-grandfather and my uncles, they all had arthritic knees, and Grandpa Joe, would walk, like this, and had really bad knees. Well, no matter what you do for a living, whether you have a sit-down job or a stand-up job, most likely your genetics are going to get you to that point at some point. But how do we get you to handle that better? That's kind of what a therapist does and what we can teach you to do. So osteoarthritis, and we'll look at the basic anatomy coming up here in our arthritic joint. We have some good pictures coming up. So the next page, the statistics. Osteoarthritis is the most common type of arthritis, the most prevalent joint disease. Before 45, it affects more men than women. After the age of 45, more women than men. Occurs a lot in overweight people. And weight loss of a little over 11 pounds reduces the risk of developing knee arthritis. So I've had dozens of patients who have hip or knee or back arthritis. And we work with them, and they say, look, I say, Joe, man, tough conversation, but dude, if you drop 50 pounds, your joints are going to feel better. You're carrying an extra small person on your back all day. It's the people who do, and then I see them a year later, they say, oh my gosh, my knees feel so much better that I've lost the weight. Now, some people they're a big bone person. Like, what's your first name?
Joe,
you got a big frame, right? So you can handle your weight pretty well. You've handled it all your life. But it's the people who gain a lot of weight, a lot of guys who retire and they're not as active as they used to, and they put on a lot of weight. Oh, next thing you know, they're not moving well and things hurt. Well, their body's not ready for it. You haven't lived it that long to take that weight for that long. So those kinds of things can affect it. There's a lot of other things that can affect arthritis as well. We talked about genetics, diet, how we eat, how we move, how we stretch, how we sleep, everything. There's a lot of things that we can talk about that can affect it. All right. My pages are upside down like this. So osteoarthritis is very costly. A lot of orthopedic surgeons say, 70% of their patients are people with arthritis. Arthritic shoulders, arthritic hips, knees, low backs. The weight-bearing joints are usually the joints that have the arthritis the most prevalent, meaning weight-bearing, meaning the knees, the hips, the low back. Those are the ones that become arthritic. Interestingly enough, most times the right side goes bad before the left. I see more people for right knee replacements before the left, right hip replacements before the left. Why do you think that is?
The dominant side, maybe?
That's a good answer, but not really. If anyone got this, it would be amazing. I went to a course, and this guy who's brilliant, he said the reason is our hips, most people's hips are off just a little bit where their left hip is rolled forward on the right. And who's been to a chiropractor, right? Have you been to chiropractors, right? So a lot of times chiropractors will look at your leg, your right leg is shorter than your left. Your right leg is, most people have a right leg that appears to be shorter than their left. It's not that the leg bones are shorter, but it's the way the hips are rotated slightly that pulls the right leg up. So you see a lot of people walking kind of like this a lot of times. It's because that right leg is shorter. Well, it has a longer way to go to hit the ground. And so they get this, we call it a Trendelenburg gait, which affects the knee and the hip more. The question is, to go back a step, why are the hips rotated? This guy said, the way the organs are aligned in our body, we have 2 lobes of lung on the left, 3 lobes on the right, and the way the heavier organs in our body are aligned upper left to lower right, which creates our left hip to be just a little tighter coming up this way, which pulls this hip back, the right hip goes forward, follow me this, and then the right leg becomes shorter. Well, with that creates a lot more stress on the right side of the leg, which creates higher instance of right knee replacement and right hip replacement before the left. Weird, but I sound pretty smart saying it. It was a pretty good course when I did it. But it made sense. Kind of like, it doesn't make, like, why I thought the same thing. Is it the dominant leg? No, not really. Is it because I'm right-handed or left-handed? No, not really. A lot of it's due to how our organs are aligned here. Or a lot of times it's how women will sit. A lot of times, like, you have your left leg crossed over your right. What if you crossed your right over your left? Could you do it? Try it. See which one is more comfortable.
They're both comfortable. I go back.
Oh, that was darn. I was expecting something different. Good answer. Well, that's good. Your hips are well balanced. Most women find it's much easier to cross one leg over one, and the other one's like, ooh, no, I can't. I'm better like this. Well, that plays into how the hips are aligned and creates everything else down the row. So the best thing you can do to prevent or treat arthritis is exercise. Keep the body moving, keep getting oxygen in the muscles and the tendons, which helps the bones, and keep moving and breathing, and of course diet. We're going to get into that a little bit too. Okay. Fact or fiction? Symptoms increase with cold, damp climate. Absolutely. Nutritional deficiencies increase risk. Absolutely. Arthritis can spread to other joints. No, it can't spread. It's not like a cancer that can reproduce cells and move to a different part. But I'll tell you, if someone has a bad knee and they're limping because of their knee, it can affect the hip, the back, the neck, the shoulder, just because they're gimping for so long, right? So it can create different movement patterns which can break down other joints. And once you have arthritis, you'll always have it. That's not true either. I had a patient years ago when we were in our first building in the village. Remember, his first name was Gary. He had a knee replacement with us. He did really well. He had his second knee replaced, and it was like end of the year, like November-ish, December, and he said, dude, he goes, you got me for 3.5 weeks, and I'm going to Arizona for the winter. And I said, okay, great, because his first knee did very, very well. Well, his second knee was stiffer, more painful, more red, more swollen. I said, dude, here's all my paperwork. Here's your prescription. When you get to Arizona, you better go to therapy out there. So he came back in April to work out in our clinic, and he came in, hey Gary, how are you, man? I said, how did therapy go? He goes, I didn't go to therapy. I'm like, why didn't you go to therapy? He goes, let me tell you. He goes, the plane ride from Detroit to Phoenix, he said, I've never experienced so much pain in my life. The pressure of the cabin with his bad knee. He goes, I had 3 Vicodin in me, Dan. It didn't touch it. He goes, I was almost crying in pain. He said, within 12 hours of being in Arizona, pain went down, swelling went down. He goes, I didn't do therapy. I just did therapy on my own. I walked every day. I rode a bike. He goes, I played golf 3 days a week. And I checked his knee out. His knee was fine. So we all got to move to Arizona if you have arthritis. But there's something to be said about a cold, dry climate or cold, damp climate versus a warm, dry climate. It has an effect on the joints. So it's all there. Okay, we talked about this. What does it mean? Osteo means bone, arthro means joint, itis means inflammation. So when you have any kind of itis, you have inflammation. I got the wrong picture on there. So if you have, I have an arthritic knee. Well, let me see the picture you guys have on there. Okay, you guys have that's a normal knee. I believe the next page might be the arthritic knee. Why do I have the wrong picture? Okay, oh there it is. I was on the wrong page. Okay, so this is what a healthy knee looks like. This is the front of a knee joint you guys are looking at. The top bone is the thigh bone, the bottom bone is the shin bone. And what we look at when we're looking at arthritis is this shiny covering of the ends of the bone. That's called the articular cartilage. It's like a marbleized, smooth, shiny cartilage bone. The rest of the bone is kind of rough and gnarly. That's where the blood is made. But the cartilage is what breaks down, and that's what arthritis looks like. On the next picture, I think you'll see what an arthritic knee looks like. There it is. That's what I wanted you to see. So that's what an arthritic knee looks like, and you can imagine walking on that. That's pretty painful because now these little discs here in between the thigh bone and the shin bone, those are called your meniscus. And those meniscus when we're younger are nice and thick and rubbery and bouncy. As we get older and we spend all of our years on our feet, those menisci become a little thinner and thinner and thinner and thinner. And next thing you know, now I'm bone on bone, and man, bone on bone really hurts. And then it starts breaking down. All this cartilage starts to get these little holes in it. And so that's when you know, I better go see somebody. Most orthopedic surgeons will tell me, they'll say, I don't tell the patient it's time for a knee replacement. They tell me, Doc, I can't take it anymore. I can't live my life. You got to do something. Because a doctor can look at this x-ray, if this was an x-ray, and say, Joe, your knee is destroyed, man. And you'll be like, well, that's fine, Doc. I got no problems. Yeah, but on x-ray, you need a knee replacement. Yeah, but Doc, I don't hurt. I'm fine. Yeah, but you... So in other words, the doctor doesn't tell you. You tell the doctor, I just can't take it anymore. By that point, you're usually 3 years too late. You should have done it 3 years ago, because most people who have knee replacements will tell me, man, I wish I would have done this 2 years ago. I wish I would have done this earlier. There's too much life to live. If you're living in pain, you can get things fixed. And there's steps that can be done before a knee replacement to reduce your symptoms so you can get through life a little easier, and we'll talk about those in a bit. Any questions yet? We're doing well? Who's had a knee replacement here? Anyone? 2? No?
I had 2 knee surgeries, but not...
You had the scopes? Yeah. Okay. Yep, good. And
Both of mine.
did you do them at the same time?
Same time.
God bless you. Look at that. I've had a handful of patients do both knees at the same time. People are like, are you crazy? I think that's the way to go.
I do too.
Rehab once. Rehab once. Because if you get one done, then 6 months later you get the other one done, now you got to go through that whole rehab process again. I've had a handful of people in my practice that I've done that have had both knees done, and because you always have one knee that's a little better than the other. So people say, how do you walk? Well, I got one's doing pretty well. The other one hurts like crap. But
You do after surgery too. You have one that is a little bit looser than the other.
that's what I mean. Yeah, after the surgery, one is usually better than the other. Yeah. I had a guy in the old building. Guy came in one day with his buddy, and they were both older, and I said, yeah, can I help you? He said, yeah, I'm going to have both of my knees replaced. I'm like, you are? He said, yeah, I'm just looking to see if you guys do that kind of work. I said, yeah, George, I can take care of that for you. So he signed up with us. Well, then 3 weeks later, I see a car pull up. Guy gets out of the driver's side, opens up the door, and old George gets up, and he stands up, and he had his walker all folded, and he picked up his walker, and he walked in. He goes, do I need this? I'm like, apparently not. Seriously. So he's my golden child on that. So OA diagnosis, OA means osteoarthritis, only 33% with positive x-ray results are symptomatic. Positive x-ray results mean the x-ray shows like, Joe, you're bone on bone, man, your knees look like junk on the x-ray. Only 33% that have that are symptomatic, meaning they hurt. So really pain and lack of function, lack of quality of life should lead you to maybe pursue getting a knee replaced. But because just looking at an x-ray doesn't always do it. How does it progress? Very slowly. Usually it starts with a little bit of pain, hurts at night, hurts in the morning. Now you're taking more Tylenol, making maybe Tylenol PM and anti-inflammatories, and maybe stairs hurt, and then eventually it just gets to the point where you're like, darn, it's really, every day it hurts more and more and more. That's the time you normally go either come to HealthQuest for a consultation or go see an orthopedic surgeon, and then they'll lay out the plan for you. And most doctors, interestingly enough, most doctors aren't really knife happy. They'd rather not see you go through surgery. They'd say, okay, let's take some conservative approaches first. Let's see what we're doing. Now, you may have said, look, I've done medication, I've done the chicken comb shots, I've done therapy, doc. Nothing's really working. Okay, let's schedule it. Because most patients, they don't want to go to a doctor that just wants to get you in the OR and cut you open. You know, they make their money that way, but the surgeons worth their salt will try to get you a conservative approach first before the last thing is the knee replacement. So treatment of our osteoarthritis could be, like we talked about, oral medication to reduce inflammation. Could be those chicken fat shots or chicken comb shots that they do in there. And what it is, it's a synthetic blend of what's called synovial fluid. And the synovial fluid we have in all the joints in our body, from the smallest pinky joint to the biggest hip joint, wherever two bones come together, there's like an oil in there. It's a lubricating fluid that keeps the bones slippery and sliding on each other. When we have arthritis, that liquid isn't there as much. So they inject this stuff that's made synthetically or from the comb of a chicken, and basically it gets you about 2 or 3 months of some good relief, because that liquid and fluid stays in your knee for about that long. Well, the body's always trying to get rid of stuff that doesn't belong in there, so eventually it wears away and it hurts. But what I tell people is, if you're going to get those shots, make sure within 2 months you have your surgery scheduled, because when that wears off, that pain's going to come back and it's time to have the surgery. Did you have that?
I had it, but it didn't work.
Didn't work at all, huh?
No.
Okay, so
Too bad.
you were too far gone, right? Exactly. So that's how OA progresses. So what are some symptoms, right? Strength loss, reduced range of motion. You can't perform your activities of daily living. Your quality of life really stinks. You have pain. You start to compensate, and then risk for surgical intervention, meaning the worse it gets, the more it happens. Now, we've actually seen some people that have had bad knees for so long that once they get their knee done, they're like, oh yeah, I forgot about my hip. Now my hip's killing me, because now their knee is all better. But because of all those years they were walking incorrectly on their knee, it affected their hip, low back, even up into their neck and shoulder. It was all caused by what was happening down here, because of what was happening in here, like we talked about before. It's a cycle of things. When something goes off just a little bit in your car, then something starts going bad. I use the example with a lot of my patients is, if someone comes in, they got a bad knee, their knee just starts hurting for no big reason. I'll look at their hips and their ribs and their shoulders, because I tell the person, I said, your body's like a car. We have 2 front tires and 2 rear tires, and we have the alignment of our middle car here. Well, if let's say you're working all day and you're sitting at a desk, but you're always looking at your screen over here to the right, well, your ribs are always rotated here for like 6 hours a day, excluding breaks and all that stuff. Well, you do that day after day, week after week, month after month, year after year. Eventually your body just is twisted this way. Well, that's going to affect something in the hips and knees. Now something's going to start going wrong here. So we kind of got to back it up and see, if we just work on the knee only in therapy before surgery, it would be like a mechanic with a car that comes in with a bad right rear tire, just putting air in the tire or patching the tire. Well, if that mechanic doesn't look at the alignment of the car that's causing this tire to go bad, he's the wrong mechanic. Something could be so far off here that's creating something in this left hip, because the ribs are so far off. You kind of got to look at the whole system and see, where can we get the alignment of the car right, so this right rear tire goes down the road like this, not like this all day and blow it up. So that's kind of what we look at when we're in therapy. I love this slide. Osteoarthritis is a vicious cycle, right? You have pain. Should have been a capital P, sorry about that. Pain, when you have pain, you do less because it hurts. I can't walk that 2 miles today, my knee hurts. Well, lack of activity causes a tighter joint. When you have a tight joint, that causes pain, less activity. Next thing you know, you're sitting on the couch all day versus walking your 2 or 3 miles that you used to do because you have pain. It's a vicious cycle. So we have to stop this. We have to reduce this, whether it's through oral medication, injections, or surgery, so that you can increase your activity, your joint restriction moves better, and then you can live your life the way you want to live it. So it just keeps going and going and going like a snowball. Okay. So this is again that healthy joint, what it looks like here. So this is the front of the knee, this is the back of the knee, this is the thigh bone, shin bone. So this is what a healthy knee looks like. This blue stuff in there, that's that synovial fluid, that's that oil or that liquid that's in the knee. Little gross, but when we were in school, we were able to do human dissection, right? We were able to work on human bodies to see what the anatomy looked like. And we opened up a knee, and we were all, with our gloves on, we were all able to feel what synovial fluid felt like. I've never felt anything slipperier in my life. It was weird, almost like space, like unbelievable how slippery that stuff was, and real thick. So it's a real slippery thing, and it's real thick, so it stays in the joint for a long time. That's how that synthetic stuff they do that makes it stays in there as well. And then the cartilage is like the end of the bone, and then the meniscus are in there as well. So every joint in the body has what's called a capsule. A capsule is like a saran wrap that goes around the knee. It's like a rubber band that goes around the knee in all different ways. That capsule has 2 jobs. Number one, it creates the synovial fluid. It produces the synovial fluid that stays inside the joint, because that saran wrap wraps around the bones, and then it keeps the fluid inside the joint. Now the body's always getting rid of it and making new, getting rid of it, making new. It's kind of refreshing it all the time. But that synovial fluid is always in the knee or in the pinky or whatever joint the body has, because that's what the capsule does for it. When you start to get arthritis, when that fluid starts to dry up or not be there so much, that capsule, that saran wrap gets tighter and tighter and tighter. Then it's harder to bend the knee because that saran wrap is tighter. It's like, oh, my knee's really stiff. Well, it's because of the arthritis, but it's also because of that saran wrap that goes around the joint, kind of locking up, making it tough. That's more common in shoulders. It's called frozen shoulder, like a frozen shoulder situation where the capsule gets so tight where you can't move the shoulder. So, looking at a different part of the body, here's a healthy spine. The brown part is the bone. The pinkish part is a disc, bone, disc, bone, disc. That's healthy. This is an unhealthy spine. The bone is kind of crinkly. The disc here gets dried up and thinner. That's why old people get short. Their discs in their spine get compressed, and we get shorter as we get older. It's because those, I forgot the percentage of our height that's based on the disc height between the spines, but as we get older, those things dry out and get a little thinner. That's why we get shorter. Again, it's a natural progression. Again, here's a healthy knee, an arthritic knee. This is the front of the knee. Healthy looks pretty good. That's that condyle is that cartilage on the end of the bone, and then as it gets arthritic, it gets kind of bone spurry and yucky and junky. So. Go to the next page. All right. Putting you at risk, aging. So if you guys can all find the fountain of youth, you'll reduce your chance of arthritis, but that hasn't been found yet. And being overweight, they say 1 pound of weight equals about 6 pounds of joint pressure. So if, there's a lot of things to be said for staying active if you can. And even if you have an arthritic knee, there's ways, or hip, there's ways you can exercise. You can get some cardio and some distance in by doing elliptical, walking in a swimming pool, sitting out or riding a bicycle. Those kinds of things aren't so compressive to the joints as we're walking on hard surfaces. But walking is a great way to stay active, lose weight, and then we'll get into some diet things here in a bit. Again, we look at genetic defects, so there's something in our genes that, historically in our family line that can create a higher chance for arthritis. And then gender bias. Women get it more than men do, mainly due to osteoporosis or osteopenia that can occur. So osteoarthritis, warning signs. Relieved with motion. So like when you wake up in the morning, if you have an arthritic knee and you get up like, oh man, it's kind of sore. But after about 10 or 15 or 20 steps or a couple minutes, it's like, okay, now it's starting to loosen up. Well, what happens is when we're sleeping, that joint stays pretty stable and that fluid is kind of stagnant, just sits there. When we get up, that fluid doesn't want to move yet. It's like, oh, I'm not ready to wake up, but you said, no, we got to get going. So once you start moving it, then that fluid starts to circulate a little bit better. That's why we feel better after a few steps of walking when we have arthritic. So pain can occur during activity, can be steady or intermittent, and then felt in compensatory joints, meaning the knee can affect the hip, can affect the back, can affect the shoulder and neck all the way up the chain. So, just a quick review. Warning signs of osteoarthritis could be swelling, tenderness, crunching, or what we call crepitus. It's like a popcorn machine when you're going down the stairs. Like, whoop, that's not good. That means something's not aligned right, or you could start to have those little bone spurs in there. So how does a doctor diagnose it? Basically X-ray. An MRI will show it, but an MRI is really more for soft tissue like muscles, tendons, ligaments, that kind of stuff. But an X-ray is really just will show bones. And if you're not sure if you have arthritis in your hip, your low back, or your knees, those are the weight-bearing joints, and you go to your doctor, make sure if they're going to do X-rays, make sure you're standing. Do the X-ray standing, because when you're laying down, the joints are in a relaxed position, so they won't really be able to see how close your thigh bone is to your shin bone. If you're laying down, the joint relaxes. When we stand up, now the weight's on it, now it'll show how close to bone on bone you are. And that's how doctors determine how bad your arthritis is. If you have good space between the thigh bone and the shin bone, you don't have much arthritis at all. There's 4 grades of arthritis, grade 1, 2, 3, and 4. There is no grade 5. 4 is the worst. Grade 1 is kind of close, grade 2 is closer, grade 3 is touching, grade 4 is you're rock on rock, you're bone on bone, and that's usually pretty painful. Yeah.
Is that the same for, I have the hip problem, is that the same for hips?
Yes.
I've had 2 of them and they still lay you down on the table.
You almost have to say, I'm not doing it laying down. It's not going to show you anything. When I refer patients to doctors, and the doctors I send them to my orthopedic friends, so they know, but I'll say, look, if you're going to go see your family doctor, insist that they do this X-ray standing. Laying down doesn't show you anything. I don't want to tell a doctor what to do because then they don't send me patients.
They don't like the patient telling them either.
Well, I mean, you're going in with an objective approach, not really an emotional, not like, because I want to. It's like, well, think about it, doc. How are you going to tell if I'm arthritic if I'm laying down? It doesn't hurt when I lay down. It hurts when I'm standing up. There's now X-ray machines out there that are attached to treadmills. It's called a dynamic X-ray, where you could actually walk on a treadmill, and it takes like a movie of your hips and knees, so the doctors can see, or the trainers or whatever can see, where is the most compression occurring in the stance phase of gait. It's really, really cool to see. I mean, sure, more of that's coming, I'm sure, but but an X-ray is probably the best way to see. MRI will do it. Sometimes they'll aspirate the joint if it's really swollen and they drain your knee. If there's a lot of blood in the joint, it's usually there's something torn, ripped, or whatever, and that could be that cartilage at the end of the bone. It could be the meniscus that's torn, could be a ligament, but usually that's a danger sign, like, yeah, something's going on. At that point, they may say, let's do an MRI just to rule out anything else, but it's just a diagnostic, steps that they'll do.
When they're draining your knee, are they draining that lubrication fluid?
Some of it. No, they're getting, no, not that, I'm sorry. They're getting all the swelling around the knee. So they go just outside the knee into just outside the capsule to drain all that out. Yeah. Sometimes they can get just inside the capsule to drain some out, but they don't take the synovial fluid.